Hi, this is Dr. Paul Searby, and I've got great news. We are finally going to be able to win the war against MRSA, methicillin-resistant Staph aureus. Staph has been eating us, eating literally our bodies since before antibiotics, in fact. And when penicillin was invented, yay, it killed staph. But within 2 years, the staph had mutated and developed a gene that disabled whatever penicillin did. A couple years later, they discovered methicillin. Yay, a better antibiotic that killed staph. 2 years later, staph developed methicillin resistance. So now we have methicillin-resistant Staph aureus, which infects us when our skin is broken. There's an article here that it prompted me here. COVID makes it worse, naturally. COVID pandemic has brought a life-threatening infection spike of MRSA in hospitals, raising serious concerns, of course. We catch MRSA in hospitals. We catch germs in hospitals. Patients go to hospitals and contaminate the rooms with MRSA and VRE, vancomycin-resistant enterococcus. There are lots of multi-drug resistant germs, and they are literally killing us when our skin gets punctured or opened in the hospital, or bed sores, or catheters, or IVs, or surgery. The germs get in and are very, very difficult to kill, and they will in fact kill us. And we need to do something about it. And there's some really, really good news. And this article here from Dr. Sean Lin in the Epoch Times, September 6, 2022, that's very, very recent, has pointed out that because of the COVID pandemic, which swept through the United States, hospitals have experienced an increase in the number of MRSA infections. The hospital overload with COVID patients has resulted in higher healthcare associated infections. So when you go to the hospital, now there's a higher risk for you to catch an infection of something really bad, MRSA being the worst of them, or maybe the most common. But it's really bad and really hard to get rid of. The medicines that used to kill it don't now. So here's Dr. Lin continues. MRSA is increasingly common in nursing homes, and that's very, very key. We are going to have to go to nursing homes to kill MRSA, and there's a way to do it. Stick with me for like 2 minutes. From September to October 2001, 48.7% of residents in nursing homes were found to harbor MRSA at any body site. Two things we need to know about that sentence here. 50% of the residents in nursing homes grow MRSA on their bodies somewhere. And these patients these patients, but certainly more in the COVID years, are going to the ICU with their 50% of them carrying MRSA somewhere on their bodies, and they're leaving it in the ICU for the next person to catch. And damned if we don't. There are studies about that. Vancomycin-resistant, the number one way to catch vancomycin-resistant enterococcus, VRE, is to go to an ICU room that has had a VRE carrier in it previously. They try and clean it, they can't clean it because we always have carriers showing up. And here we have MRSA carriers from the nursing homes in ever-increasing numbers during the COVID years, contaminating the nursing homes, yielding higher healthcare-associated infections. And we want less of those. In fact, we want none of them. Wouldn't that be nice? Let's see. We talked about that. We got vancomycin resistance. Vancomycin has historically been the drug of choice, sometimes the last resort for treatment of serious MRSA infections. However, its increased use has already led to vancomycin-resistant Staph aureus. It's going to kill us. It's going to get us. It's going to win. And Dr. Lin finishes with, as viruses mutate faster than vaccine development, bacteria also upgrade faster than antibiotic development. Superbugs have already become one of the biggest crises in the world. Drugs fight and at the same time train the microorganisms on how to battle the drug. Battles with diseases seem to be another story on the micro level. If one day MRSA causes an 80% mortality as its ancestor once did, we may finally realize that we need another way to resolve this arms race with the microbial world. damn straight. We need to start killing the germs where they are living. In Japan, we had to nuke the homeland to win the war. Well, we're going to have to nuke MRSA's homeland. And where is it? Well, he told us. Dr. Lin told us it's at nursing homes. Why is it nursing homes? Well, back in the day, this is not anything new. Dr. Lin said that 50% of nursing home residents are harboring MRSA. Harboring is such a mild word, but it's growing on them, and they carry it around and contaminate everything around them, their own surgeries, their own IVs, as well as the rooms and everybody else's here. And it's time to stop this damn stuff. So MRSA, back in 1993, we're going back in, we got some more articles here. I got a ton of articles. I got a ton of research here all about this stuff. I'm trying to do this fast here. In 1993, they tried to eradicate methicillin-resistant Staph aureus using mupirocin ointment in a long-term care facility, meaning a nursing home. So they tried to eradicate MRSA from the patients in the nursing homes and failed. 40% of them had recurrence of MRSA. It came back. The mupirocin weekly maintenance was not adequate to prevent recurrences. And at the time, in 1993, 20% of the nursing home residents were colonized with MRSA. Now it's 2022, whatever that is, 27 years later, 29 years later, 20% has grown to 50%. Our seniors are harboring MRSA. That's where we need to nuke the seniors. Not quite true, not quite true. In 1995, Dr. Rossi, another article, this one was a letter to the Lancet in 1995, our Northeast Medical Society, big newsletter, medical letter. And Dr. Rossi puts her finger exactly on the problem. Denture carriage of methicillin-resistant Staph aureus. Yes, the dentures grow MRSA. Dentures are long known to harbor germs again, and they live in a perfect incubator of mouths, warm and wet forever. We never sterilize them effectively. The tablets do not work. And in fact, 2008, Dr. Lee found exactly that there is no way to chemically sterilize a denture. And in fact, that's what Dr. Rossi found too, that and what she writes is extremely important. So give me just a minute to go through this paper. She writes, eradication of MRSA in long-term carriers has proved often to be unrewarding. Yes, especially in patients with wounds, chronic debilitating diseases, or indwelling catheters and other foreign material, specifically people in hospitals and in nursing homes with open skin. Despite careful efforts to treat the carriers with intranasal and dermal applications of mupirocin ointment, alone or combined with systemic chemotherapy, antimicrobial chemotherapy, some of them relapsed. It's highly unlikely that eradication would succeed without sterilizing the dentures colonized by MRSA. They looked and found that the patients who relapsed were wearing dentures, and the dentures were colonized with MRSA. So Dr. Rossi sterilized them with heat and found that if you sterilize the dentures with heat and then decolonize the patients, that they can remain MRSA negative. You can actually cure MRSA carriers. Like 50% of our nursing home residents. Do you want to bet how many of the 50% of the nursing home residents are wearing dentures colonized with MRSA? I'll bet you almost every damn one of them. Anyway, Dr. Rossi finishes in her letter to the Lancet in 1995 saying, to avoid inevitable failures in eradication of MRSA, which has gone on to this day, to avoid inevitable failure, we suggest that whenever eradication of MRSA is deemed necessary in cases of nasal, oral, or throat carriage, heat treatment of dentures should also be done. Yes, Dr. Rossi found the source, found the reservoir, found the homeland of MRSA. It was found to be dentures. However, she writes, dentures are made of a material that cannot be sterilized at home by the use of antiseptic solutions. Correct. Or boiling water without causing serious damage. Not correct. Boiling water does not seriously damage dentures. I make them myself in my dental office. We polymerize the plastic with boiling water until they are solid. And here's another piece of information that somehow the dentists seem to have forgotten and never told the doctors. Dentists seem to believe the same thing. Don't boil a denture. Heaven forbid it'll become unusable. They say it in their 2011 statement. The American College of Prosthodontists have stated, do not boil a denture. Well, they're just flat wrong. And they're more than wrong. They're killing us because they're wrong. This is from Wikipedia. This is from, this is called glass transition. Where, like glass, when it's a certain temperature, an amorphous solid, when it's heated up, it gets all floppy and malleable, and when it cools down, it hardens up. Fine, that's what glass does, and it's called a glass transition, and there's a temperature at which it hardens. Well, polymethyl methacrylate, which is right here, which is what dentures are made of, it's also called plexiglass. It's the same stuff. The glass transition temperature for polymethyl methacrylate is 105 degrees Celsius. That is 5 degrees higher than boiling water. There's a reason why we can sterilize dentures and with boiling water, and it doesn't hurt them. That's what there are no studies showing that boiling dentures causes them to be unusable, yet the prosthodontists state that, and the ADA just follows along, and they're all wrong, and it's not provable, and it needs to stop because dentures have got to be sterilized. And in 1985, in the JADA, Dr. Rohrer did an entire study, where is it here? 1985, there it is, that microwave sterilized dentures. 3 minutes in a microwave kills the germs. It does boil the water, and the denture will get up to 100 degrees, but that's below its glass transition temperature, and it will not melt and become unusable. But Dr. Rohrer back in 1985 said, sure, it's easy. Just zap it. He was trying to zap metals and everything and got away with it, and it's all fine as long as you do that. So here's the answer. This is it, and this is what I do for my patients here. This is a partial denture. It's got plastic, which harbors germs, and it's got metal, chromium cobalt. All right, here we do this one, and then we got a regular plastic denture. Goes in a coffee cup in a microwave. I've had these made for my patients for daily denture sterilization. Why not do it every day? Microwave in water for 3 minutes, kills all the germs. Add some water. There we go. Now 3 minutes in the microwave. The dentures are clean, sterilized. The MRSA is gone. The VRE is gone. The Candida and the Klebsiella and the Pseudomonas is gone. Zero. And the patients in the nursing homes need their dentures sterilized 3 minutes in the microwave once per week. Again, it's been proven once per week is good enough to cause a chronic yeast infection caused by the denture, of course, on the palate, which is denture stomatitis. Seems to be the only thing that the dentists are worried about, even though it's killing us in the ICU. But denture stomatitis has been studied out the wazoo. But one treatment per week, one sterilization of the denture per week is enough for the yeast infection in the palate to heal itself. So if we were to get the CDC to mandate dentures are sterilized once per week in any healthcare facility, be it a hospital, be it a nursing home, then the MRSA diseases, the MRSA contamination of ICU rooms, the MRSA contamination of surgeries, surgical sites and catheters and IVs for dialysis patients will drop like a stone. We'll be able to cure, well, at least fight back finally on MRSA without drugs that become resistant by the damn thing. And the answer to this, I've got all this medical research about what's going on for the past 20 years, but to jump to the end, we need to ask the CDC to do their job a little bit better. They were really close. Again, the CDC this is the guidelines for disinfection and sterilization in healthcare facilities. I mean, that's it, right? for 2008, updated in 2019. This is it. This is it. We have critical items. We have semi-critical items here. Critical items are, you know, IVs, needles, and the scalpels and everything that has to be absolutely completely sterile. Semi-critical items are those that contact mucous membranes or non-intact skin. That sounds like a denture to me. It includes all the cystoscopes and laryngoscopes and endoscopes and catheters and things, but it should also include dentures, don't you think? It's a healthcare item that contacts mucous membranes. In fact, it sits on the mucous membranes 24 hours a day in a warm, wet mouth, growing germs. And the CDC gets really close. They say that semi-critical items minimally require high-level disinfectant using chemical disinfectants. But we've already found, well, it's been proven over and over again, most notably in 2008 by Dr. Lee, that there are no chemical disinfectants that can sterilize a denture. But dentists only think of mouths, and doctors only think of chemical disinfectants. In fact, it requires microwaves. And if you were to ask, you know, further on in the CDC's 2019 updated report, they talk about microwaves. They're used in medicine for disinfection of dental instruments, soft contact lenses, dentures, milk, and urinary catheters for self-catheterization. Yeah, pasteurization, where you raise something up to a certain degree, 65 degrees. Milk can be sterilized by microwaves. You get it up to 72 degrees for a couple of minutes, and it kills germs. Dentures can be sterilized by microwaves. You get it up to 100 degrees in boiling water, and a microwave the snot out of the little germs, and in 3 minutes they're dead and gone. And the CDC needs to say, all right, whoops, we made a mistake. We need semi-critical. We need to call dentures what they really are: a semi-critical healthcare item that contacts mucous membranes. It needs high-level disinfection. Although in this case we're not going to use chemical disinfectants because they just don't work. We're not going to continue to ignore it for another 22 years. So, and then we're going to use microwaves to sterilize dentures in healthcare facilities, wherever they are. It costs nothing, and it works 100%. This is a gift from God. He's plumped it in my lap. I'm trying to share it with you people here. We need to fight back intelligently, and we need to stop letting dentists screw it up, and doctors to accept ignoring it because they can't be liable for it. That was a conclusion in 2008. Well, we can't sterilize this thing chemically, so we're just going to ignore dentures from now on. And that was 2008, and they're still ignoring it, and it causes it turns everyone into agar plates, for lack of another term. I don't even know where a picture of an agar plate went. There it is. This is us. This is a denture. It grows germs. This is a denture carrier. It carries the germs. A denture wearer is a carrier because it carries the plastic that carries germs everywhere. And it can be killed. 3 minutes in a microwave kills the germs, doesn't hurt the denture. That's really good news. That means we can kill germs, and even if you're not in the nursing home, that just makes perfect sense. This is what I'm telling my patients to do. We're no longer going to let dentures grow horrible germs, stink like hell. We're going to sterilize them. We're going to take a bath and like a shower and sterilize them at least once per week, and MRSA will drop like a stone. We'll finally be healthier. You're very welcome. I will accept the Nobel Peace Prize for dentistry. I presume it'll be the first one. You're welcome. My name is Dr. Paul Searby. I am a general dentist who specializes in old people. I make dentures. We make them in boiling water, and then when they come in to be disinfected, when they come in to be repaired, which is often, I can disinfect them before I give them to my son in the lab to fix. So this is very important to me. It's very important to you. Sterilize your dentures. Hospitals are healthier. Their costs of infection control go down. It's just good news. So that's what I'm sharing with you. Thanks for your attention. See ya.